Hello, Professor. Hello, everyone. This is Bindu, and I'm going to start the presentation. And firstly, I'm going to introduce my team member, Chanchal Virk and Navjot Kaur. So, firstly, I'm going to start with the overview. In this presentation, we will be covering job description for a nursing leadership role, competency-based approach, job description for nursing leadership role and its specification with rationals, interview questions, rationals to find the right candidate. So in this slide, we will be discussing about writing job description for a nursing leadership job. A job description is a written document that outlines the duties, responsibilities, qualification, skills, and requirements of a specific job role within an organization. It provides a clear understanding of what the job entails, including the task to be performed, reporting relationships, expected outcomes, and any relevant information about the position's role within the company. Job description serves as a valuable tool for recruitment, performance evaluation, and organization planning, helping both employers and employees understand the expectations and requirements associated with a particular job. So in this slide, we will be discussing about like when writing a job description, what approach would I be using, and what is the reason behind choosing this specific approach. So I would be using the competency based approach because the reason is it focuses on the desired competencies and behavior of a nursing leader, list critical thinking, communication, problem solving, and decision making skills. Also, it emphasizes the ability to collaborate and build relationships with diverse stakeholders. And also, it includes leadership qualities such as adaptability, resilience, and emotional intelligence. And also, the reason is like it's suitable for positions that require strong interpersonal and leadership skills. So, that is the reason why I would be using this approach while writing a job description for a nursing leadership job. So this is my part, and the next slide would be continued by Navjot. Thank you.
Hi, this is Navjot Kaur and here I'm present on the behalf of my group member, and now I'm going to talk about the job description for a nursing leadership role and its specification with rationale. But firstly, I want to talk about the job description of the Director of Nursing Services. Actually, it is a pivotal leadership role responsible for the overall management and direction of nursing operations within the healthcare facility. So he includes a lot of responsibilities, qualification, and as well as rationale for any kind of action. And he also collaborates with interdisciplinary teams, oversees nursing staff, and drives initiatives to enhance patient outcomes and organizational efficiency. Now I am going to explain the responsibilities of the Director of Nursing Services, and it includes some responsibilities such as the strategic leadership, and in this responsibility he develop and implement strategic plans for nursing services aligned with organizational goals and objectives, and as well as the quality improvement and excellence in nursing practice. Also, it includes the establishment of goals and objectives, performance expectations for nursing staff, and in the other part, that is the operational management, it includes the oversee day-to-day nursing operations including staffing, scheduling, and the resource allocation, and ensure compliance with regulatory standards, policies, and procedures governing nursing practice, and monitor key performance indicators, analyze the data, and implement process improvements to optimize nursing efficiency and the effectiveness. And in the third part, that is known as the staff development and engagement, and it includes the recruit, onboard and retain qualified nursing staff. Mainly it includes the nursing staff through effective recruitment and retention strategies, and it provides leadership, mentorship and professional development opportunities to nursing staff to promote growth and advancement. And the positive work environment is also important for the better outcomes. And the fourth one is quality assurance and patient safety. And the patient safety is also the responsibility of the director of nursing services, because if the one person is working in any kind of agency or in company or through the healthcare and through the healthcare sector, so it is necessary to maintain the patient safety as well as the professional safety of the professional workers. So establish and maintain systems for quality assurance, risk management and the patient safety. Enhance patient outcomes, satisfaction and experience through evidence based practice and continuous improvement. And the last responsibility includes the interdisciplinary collaboration. Collaborate with the physicians, administratives and the other healthcare personnel to do the other things and the patient care and achieve organizational objectives, which we make in the starting or we make for any kind of group. So participate in interdisciplinary committees, task forces, serves as a liaison between nursing services and the other departments to promote communication, collaboration and coordination of care. Okay, now I'm going to talk about the qualification of the director of nursing services. Firstly, I'm going to talk about the education. Then it needs the master's degree in the nursing healthcare administration or a related field required, and in the license we need the current RN license in the state of practice. And if I go talk about the experience, then it needs minimum of 7 years experience in the nursing field, and with at least a 5-year experience as a manager or directive role. And in the leadership skills, he will demonstrate the ability of strong decision making and how to solve the problem and the conflict if occurred in the healthcare teams and the other personals. And as well as in the communication skills, he will explore the communication styles and that how to communicate with the others, which includes a different kind of communication ways such as the verbal, non-verbal, written communication skills, one-way or two-way communication. So and in the strategic planning, it includes a record about actions for the evaluation that it is a positive or the negative outcome. And in the regulatory knowledge through understanding of healthcare regulations, best practices in nursing leadership and management. So this kind of things are comes under in the qualifications. So okay, now I'm going to talk about the rationale of qualifications. The first one is education. Education is most important component if you want to become a professional worker in the nursing field or any kind of field, because firstly you have to knowledge about the work, or then you can do the work appropriately. So the license gives you the opportunity to work in the nursing practice according to the rules and regulations of it. So that's why the license is needed. And the experience helps you to become a confident nurse or the confident person to do any kind of activity, to handle any kind of situation, to handle any kind of behavior of the patient and any emergency situations. So by the experience you can effectively manage nursing operations, and for safe healthcare environment it is needed. And the leadership skills also helps you to do the work in the collaboration, or how to do the work in the cooperation or by the cooperation or in the team. So that's the needed. And by communication skills we can resolve the conflicts, and it is really helpful to maintain the good interpersonal relationship with the co-workers and as well as with the patients, and it helps to gain the trust of the patient. And by the regulatory knowledge, a thorough understanding of health care regulations ensure compliance with the standards and promote patient safety and quality of care. And by the strategic planning is essential for aligning nursing services with organizational goals, driving innovation and adopting to evolving healthcare trends. So that is comes under the specification with rational, and that how it is needed.
Hi, Professor. My name is Chanchal Virk, and here I'm going to explain my topic. So my topic is the interview questions. If I took any interview of any candidate, I will put these questions. The first one is the behavioral questions. In the behavioral questions, I ask the question like, can you tell me about a time when you had a conflict in your team? So this thing helps me to know about the candidate knowledge or their how they handle the different type of specific situations. So it's important. And in the second, I will also put the question technology related. So everyone knows today's technology is very important and it's used in every different type of fields. So it's also used in the hospitals. So it's very genuine to put the questions related technology. So I also put the question related this that candidate is able to handle different type of technology instruments or not. So next question is the open-ended questions. These type of questions helps me to know about the candidates different knowledge related to different kinds of things, and their helps me to encourage the candidate to express themselves and themselves knowledge. For example, if I put the question in this, how do you define the success in your own way? So candidate can express their own views related to success. So next question is the reflective question. It's very important in every kind of field to put this type of question. Reflective question helps us to know about the candidate's strengths or weaknesses. For example, if I put this question about the emergency department, candidate tell us that he is able to handle the emergency situation or not. So the next question is the problem solving abilities. Now I put these type of questions because these type of question helps me to know about the candidate abilities, that he is able to solve problems or not. So next one is the situational, and this I put the question to the candidate about the different kind of situations, and I give different kind of scenarios. Then this thing helps me to know about the candidate's priority. That candidate, which thing candidate give the priority first. So these are the questions, and now I'm going to the next slide. Hi, and now I'm going to explain about the rationale to find the right candidate. To choosing the right candidate, our first rationale is skills and qualification. So every student or every candidate need to meet this qualification. Like it's very important to meet the qualification. Next one is the experience. Every field, mostly the hospital field, they need experience in different kinds of fields like emergency departments or gynecological departments. So it's very easy to choose the perfect candidate if he's having the experience. Next is cultural fit. Nowadays, every candidate or student need to fit in the culture, different type of culture, and they should need to respect different type of cultures. So this is also a rational. Next one is motivation and enthusiasm. Every candidate or a good candidate need to be motivated for their work and enthusiastic. Problem solving abilities. A candidate need to solve different kinds of problems, especially in the hospital. If we are having an emergency, he or she will be able to handle different kinds of conditions or specific situations. So it's also the good rationale. Next is communication skill or leadership potential, and these are the rationales for choosing the right candidate. Thank you. Hi, I'm going to explain the summary. In the upper slides, we all explain all about the job descriptions. In this, we explain what a leader do or not to do for selecting the best candidate. And we also explain the best questions which a leader need to put in the interview. And we also explain the rationales for selecting a right candidate for the job. So this is the summary. Thank you.